I decided to do my project on acid reflux, also known as gastrointestinal reflux. Acid reflux occurs when your stomach contents come back up into your esophagus. And another thing that can happen from acid reflux is heartburn, which is when the stomach acid touches the esophageal lining. Some of the symptoms that are associated with GER are bad breath, problem swallowing, nausea, respiratory problems, vomiting, pain in your upper chest or abdomen, and the wearing away of your teeth. There are some specific groups of people who are predisposed to GER. This includes people who are overweight or obese, women who are pregnant, people taking certain medications such as painkillers or antihistamines or a couple other medications too, and some people who smoke or are exposed to secondhand smoke. These people are more likely to get GER. Similarly to the people who are predisposed to GER, the potential causes include people who are pregnant or obese, which causes increased pressure on your abdomen, which would then cause more pressure on the esophagus, causing the stomach acid to go up. Certain medications, secondhand smoke, and smoking in general are all pretty high causes of GER. In terms of nutritional risk factors, there have not been many discussed that are a specific cause of GER. The general occurrence of GER every once in a while is very common. Most people have experienced it in their lifetimes. However, when GER becomes more persistent and happens often, it becomes gastroesophageal reflux disease. When diagnosing GER, your doctor will diagnose it based on your signs and symptoms and medical history. If your GER symptoms do not improve or you have difficulty swallowing, your doctor may recommend certain tests to determine if you have GERD, which is gastroesophageal reflux disease. Some of these special tests will include an upper gastrointestinal endoscopy or biopsy, an upper GI series, an esophageal pH impedance monitoring, or esophageal manometry. Some complications of GER can result in diseases like esophagitis, an esophageal stricture, respiratory problems, and Barrett's esophagus. Esophagitis is an inflammation of the esophagus. Esophageal stricture describes the narrowing or tightening of the esophagus. And Barrett's esophagus is damage to the lower portion of the tube that connects the mouth and the stomach. For the treatment of GER, there's many ways that you can control GER by not eating or drinking items that cause GER, such as greasy, spicy foods or alcoholic drinks, not overeating, not eating 2 to 3 hours before bedtime, losing weight if you are overweight, and you can quit smoking, and these things will lessen the effects of GER. If you go to a doctor to treat your GER, you may be prescribed with a couple of different things depending on the severity of your GER. You may be prescribed lifestyle changes, medications, or surgery, or a combination of all three of these things. If your doctor prescribes you with lifestyle changes, this may include losing weight if you are overweight, wearing loose-fitted clothing around your abdomen so that it's not tight on your esophagus, staying in an upright position for 3 hours after eating large meals, sleeping at a slight incline of 6 to 8 inches, putting a post underneath your bed to lift it up a little bit, and the best thing to do would be to quit smoking if you are a smoker. This is a drawing of the stomach and the esophagus. As you can see, the esophagus/stomach on the left is the normal one, and the one on the right is the abnormal one that has acid reflux. You can see the 2 sets of sphincters at the end of each stomach where the esophagus begins. On the normal one, the sphincter is closed, and on the abnormal one, it is opened, allowing for the stomach contents to come out of the stomach and into the esophagus, causing acid reflux. Nutrition plays a key role in treating acid reflux because the foods you eat can affect the way that your stomach behaves in terms of acidic foods and greasy foods that make your stomach more acidic than it normally is, which could worsen the effects of acid reflux. So nutrition is definitely a key role in treating acid reflux.